Behavioral issues we now know, and I think this is the most exciting development in children's mental health in the last 40 to 50 years. Kids who exhibit concerning behaviors are often struggling with some very important skills. And I've grouped those skills as flexibility, adaptability, frustration tolerance, problem solving, emotion regulation. Kids with disabilities are not a monolith, obviously. They represent many, many different issues and different profiles. But many kids with disabilities are more prone to be struggling with the skills that I just named, and or also have a lot of expectations, more expectations, that they're having difficulty meeting by virtue of their disability. And so that combination is that's a good recipe for causing concerning behavior. Kids do all if they can is a rough summary of the fact that we now know that kids who are not doing well are struggling with the skills that are needed to be doing well. We now know that. So kids do all if they can is a rough summary of that. It's also a rough summary of the fact that kids would very much prefer to be doing well. Doing well works out better than doing poorly. And both of those are my efforts to combat more traditional belief systems. For example, kids do well if they wanna. Kids do well if they wanna suggests that if a kid isn't doing well, it must be because they don't want to do well. And that makes concerning behavior in kids out to be an issue of motivation, which it is not. But because that's how a lot of people were trained, a lot of people think that the best way to help a kid with behavioral challenges is to motivate them or to give them the incentive to do well. And I just don't see that working out very well. And we wouldn't expect it to work out very well if we already know that concerning behavior has more to do with skills and expectations that kids are having difficulty meeting than it does to do with motivation. I started with the population I was mostly working with, kids who had very big, we might say, frustration responses, or as one major publishing house decided it should be called, explosive kids. So I don't put a great deal of effort into defining what an explosive kid is. The rough summary is that these are kids with big frustration responses and kids who are doing things like, what does big mean? Kicking, screaming, hitting, swearing, biting, spitting, running, destroying. Those are big. But the reason that we've extended the model to other kids is that, number one, all kids get frustrated. All kids have difficulty meeting certain expectations. Not every kid has a big frustration response, but why would we reserve the problem-solving process only for kids who have a big frustration response? That in some ways, they're the kids who need it the most because they're the ones who are most frequently misunderstood. And they are the ones who are also more often on the receiving end of punitive exclusionary disciplinary practices that are actually doing them harm. But every kid has expectations they're having difficulty meeting. And once again, I haven't come across a kid yet who couldn't benefit from having caregivers try to solve problems with them collaboratively and proactively. No doubt. And that's why I tell people I don't really care what the kid's frustration response is. What I really care about is there's an expectation they're having difficulty meeting. So what's interesting is I don't really care if there is a behavioral manifestation of a kid having difficulty meeting an expectation. If a kid is having difficulty meeting an expectation and they're showing us that they're having difficulty dealing with that on their own, they need us, whether they're communicating that they need us through their behavior or not. No. Um, every Almost every childhood psychiatric diagnosis is defined by concerning behavior. Since concerning behavior is the frustration response, I'm really not focused on the behavior, which means I'm really not focused on the diagnosis that is a rough summary of that behavior. I'm focused on the expectations the kid is having difficulty reliably meeting, which is what we call unsolved problems. And I realize this is a very different level of analysis for many people. I also appreciate the fact that there is some pride that can sometimes go along with a particular diagnosis, whether it is dyslexia or pathological demand avoidance or autism spectrum disorder or ADHD. And I think that that's because the diagnosis partially helped caregivers understand the kid better. But as it relates to why this particular kid is having difficulty meeting this particular expectation, irrespective of the behavioral manifestation, irrespective, in other words, of the kid's frustration response, the diagnosis is not going to tell us what's making it hard for this kid to meet this expectation. Once again, whether the diagnosis is pathological demand avoidance or ADHD or autism spectrum disorder or dyslexia, we're taking one kid at a time and figuring out what's making it difficult for them to meet an expectation. And by the way, if we didn't do it that way, then we would assume that every kid diagnosed with XYZ disorder was having difficulty meeting this particular expectation for the exact same reason. And that's not true. So we might actually be shooting ourselves in the foot by overemphasizing the psychiatric disorder. So that's not me saying that the disorder is irrelevant. It's not me saying that people shouldn't be proud of a disorder or of what that disorder says about them. All good. But as it relates to why this particular individual is having difficulty meeting this particular expectation, the diagnosis might get us in the ballpark, but it's not going to tell us where our seat is. Nothing heals like doing the right thing. Nothing heals like seeing a kid through more accurate, compassionate, productive lenses. Nothing heals like seeing things get better. So I do get caregivers who are wondering why what worked for their well-behaved kid isn't working for this kid. So I need to help people understand why this kid might be different. I might also have to help them understand that what they did with the other kid may not have actually worked. It's just that they got away with it, right? So, but once again, I'm not spending a whole lot of time with caregivers on why what you did before didn't work, or making them feel bad by telling them that they didn't have to go through all that to start doing this. They could have started doing this from the word go and saved a lot of time, which is where I hope society gets to. But I'm not spending a whole lot of time on why what they previously did isn't working. Let's just start viewing this kid through the right lenses, and let's start meeting this kid where they're at and solving problems collaboratively and proactively. And eventually, what they used to do will be a distant memory. Our reference point for collaboration as it relates to the most difficult kids there are to collaborate with is infants. Now, infants have no words. Infants do have expectations they're having difficulty meeting. Infants do communicate to us that they're having difficulty meeting those expectations. So as it relates to that, it's a level playing field between infants and any other human being. How do we collaborate with infants? We pay attention when the infant is communicating to us that something's the matter. We try to figure out what they are communicating. They have no words, so they can't tell us exactly. What they can tell us is that something's the matter. And what we do over time, and hopefully this happens pretty quickly, is we get to know the infant. We might even appreciate some nuances in how the kid is communicating as it relates to what's the matter. But eventually we hope that we now have a pretty good repertoire of what could be getting in the infant's way, what they are communicating. And we also have interventions that we apply. For hunger, we provide food. For cold, we provide a blanket, or we dress them up warmer. So you get the idea, right? That's what I would call collaboration. And from the word go. That should never end. But it also gives us a nice reference point for thinking about non-speaking kids. All non-speaking kids are communicating. How are we doing it using our eyes to figure out what they're trying to tell us? How predictable is what they're telling us? Because we shouldn't be being surprised every single time. And how can we collaborate with them on addressing some of those things? One thing I'll say about infants is that if you get it wrong, if they're cold and you stick a bottle in their mouth, you're not going to solve the problem and they're going to let you know it. I would say the same thing about non-speaking kids of whatever cognitive level. So the basic principles continue to apply throughout childhood, irrespective of the profile of a kid. I get it. Some kids are going to be able to participate more meaningfully than others. Remember, infants are our reference point. Some kids are going to need us to be very patient as we are either getting to know them or giving them some rudimentary ways of communicating with us, whether that be grunting or whatever. The good news is all kids communicate, including infants. How well we can collaborate with them does depend on their profile, but I find that we can help every kid participate to one degree or another, and we can help every kid participate in collaboration to an increasing degree over time. What is that going to look like? It's going to be different for every kid. Plan A, B, and C are the three plans that I articulated as people's options for solving problems with kids or for handling problems with kids. Plan A has historically been the popular one, and that's where the adult is not only deciding what's getting in the way for the kid of meeting an expectation, but also deciding what the solution is. Still very popular. Also the cause of a great deal of concerning behavior. Yes, we are wrong a lot in terms of what's getting in the kid's way. And we are therefore wrong a lot in terms of what solution is going to address what's getting in the kid's way. So us caregivers, lots of this going on, are spinning our wheels a lot, causing a lot of concerning behavior, and wasting an enormous amount of time by not consulting with the kid in one way or another about what's making it hard for them to meet the expectation and about what potential solutions might be. What I just described is Plan B. That's where you are solving the problem collaboratively, with the kid as a very active participant, an indispensable participant in helping us understand what's making it hard for them to meet a particular expectation and in coming up with a solution. Plan C is very important as well, because I find that a big cause of concerning behavior, aside from the fact that us adults have already decided what's getting in the kid's way and have already imposed a solution, often, by the way, with a sprinkling of adult-imposed consequences. I was just back to Plan A there for a second. Another big cause of concerning behavior is the fact that we're putting expectations on kids that we already know they can't meet. Or we're working on too many things at once. Plan C is where we are putting expectations on hold, at least for now, both as an act of prioritizing. If this kid has a lot of unsolved problems, and they do tend to accumulate when they don't get solved, we're not going to be able to solve them all at once. And if we try solving them all at once, we're going to end up solving none of them. That's prioritizing. But also Plan C is about expectation management. Don't put expectations on kids you already know they cannot reliably meet. And there's a lot of that going on out there too. Those are the three plans. Now, the lens shift is this. If we think about how we have been characterizing these kids historically, attention seeking, manipulative, coercive, unmotivated, limit testing, then for some people, the use of power, plan A, might make sense. But none of those characterizations are accurate. When you finally come to the recognition that this kid is struggling with certain skills, the ones we talked about earlier, plan A actually doesn't make any sense at all anymore. Plans B and C start to make a whole lot more sense. So you asked a little bit about the lenses. Lenses are coming into play here when it comes to which plan we think is going to actually help us solve this problem. For some people, easier than for others. But the way you get good at it is by practicing it. And if it's not going well, having somebody, and we have providers all over the world, coach you along a little bit in helping you learn how to do it well if it's not going well for you. A lot of parents practice alone without anybody helping them, gets the job done. And a lot of caregivers, I should say, not just parents, need a little help. But we also have the Lives in the Balance website where people can get additional help through all kinds of free resources and videos to show people what this is supposed to look like. And a lot of people find those to be very useful as well. One thing I will say, nobody's good at this the first time they do it. So this is really about practice, figuring out what didn't go well, practice. Eventually, people get good at it. Once again, some faster than others. Well, I do think it depends a lot on your mindset. A lot of people still don't think that parenting or discipline, a lot of people, it's never occurred to them that parenting and discipline should have a huge dose of collaboration. They've been defining parenting and discipline in rather narrow terms. You can get away with that with some kids. You can't get away with that with the kids that I work with. And the way you're not getting away, the way you know you're not getting away with it is that it's ugly. It's not working. When it gets ugly, there's your signal, right? Even when it's not ugly, we really need to be asking ourselves, is what we really want to be teaching this kid is that power, plan A, is the best way to solve problems, or is the best way to solve problems and a way that is going to have much more ramifications for the real world, collaboration. So I think it's fascinating. The real world is more about collaboration than it is about power. And that's by a long shot, by the way. And yes, if I get caught speeding, I could get a speeding ticket, but there aren't that many other examples of plan A in the real world. When you really think about it, the world is filled with expectations, most of which most of us meet. And when we're having trouble meeting an expectation, it is worth asking ourselves, how do I hope someone will approach me about that? And it's unlikely that that's going to be plan A. So there's some thinking that needs to be done here. There's some intentionality here. We have a new video on the Lives in the Balance website related to doing CPS with young kids. And in it, I was interviewing many parents about their aspirations for their very, very young kids. Some of them are infants. What skills they thought their kids were going to need in the real world, what fears they had about what the real world was going to throw at their kids. And it became so abundantly clear that plan A, power, being unilateral, being punitive, wasn't going to get their kids ready for the real world. That's plan B. But that does require some thought. And hopefully you'll put a link to that video in the so people can access that as well. Now, there is checking off skills is not the hard part. Writing unsolved problems is a bit of an art form, but there's a 20-something minute video on the Lives in the Balance website to teach people how to do it. But yes, the assessment of skills and unsolved problems, I get it. The word assessment is the leading word. But that doesn't mean that it is limited to mental health professionals and educators. Anybody can use the assessment of skills and unsolved problems to understand their kid better. You can try, but I've always said you don't know what's going to be easy until you get into the problem-solving process. So there are things I've seen people think this is going to be an easy one, and it turned out to be kind of complicated. And I've seen ones that people thought, oh my, we would never start with this one. It's too big, not be so big. So if people want to start with something they think is going to be easy, that's fine. You just don't know what's going to be easy until you're actually in the problem-solving process. If you are in the midst of a kid becoming escalated, there's a very good chance that you haven't done the assessment of skills and unsolved problems yet. So here we are again. The whole point of the assessment of skills and unsolved problems is to identify those unsolved problems proactively, prioritize them proactively, meaning which 2 or 3 are you going to try to solve now, collaboratively and proactively. The remainder you're actually going to put on hold for now. That's plan C. So now we are finding ourselves in the midst of a kid becoming escalated. If we've already done the ASAP, I got to ask myself, how'd that happen? Because if it's been put on hold for now, it's not going to cause escalation. And if it's been solved, it's not going to cause escalation. So really now, assuming that so here's the answer. If the kid's escalating, my first question is, have y'all done the ASAP on that kid yet? If the answer is no, there's your answer, right? Do the ASAP. Organize the effort, right? Identify those unsolved problems proactively, decide which ones you're going to start solving, and decide which ones you're putting on hold. That's critical, right? That's the biggest part of organizing the effort and getting people out of the heat of the moment. So there's really only a few possibilities now. And I'll get to the end of your question in a second. One possibility is that the caregivers weren't doing B or C, they were doing A. They slipped. Okay, let's make sure we're not slipping, or we're going to get the frustration response we've always gotten, right? But at least now we're defining it as slipping rather than good parenting. Another possibility is that it was something that was removed for now, and we brought it up anyways. That can happen. Another possibility, I suppose, is that we have a solution that we came up with, but it's not working very well. That's good information. Now back to your question, the end of your question. What if the kid is starting to become agitated in the midst of doing plan B? Few possibilities there. One is you surprise the kid. You may be trying to do plan B proactive. First of all, don't do it in the heat of the moment. That's why there's the ASAP, is to get you out of the heat of the moment. That's the whole point. But even if you're doing it outside the heat of the moment, if you don't tell the kid what it is that you want to talk with them about, you spring it on them, or you interrupted something they were doing. My recommendation, make an appointment with the kid and let them know what it is that you'd like to gather some information about, something you're curious about, right? And that's the unsolved problem y'all are going to be talking about. And make an appointment, right? Sometime that we're going to get together to talk about this because the caregiver is curious about what's getting in the kid's way, right? That's better. At least we're not surprising the kid. And once again, you can surprise the kid even if you're doing plan B proactively because you interrupted the kid and the kid didn't know what you're talking about in the first place. So it's still a surprise, right? Another possibility is that this kid is having difficulty participating in plan B for one reason or another. That could be language processing skills. Could be a lot of things, right? we'll have to ask them about that. Tell me what's hard for you about this, right? And then another possibility, I'm not being exhaustive here, is that this kid has had so much plan A in their life. They're still betting on the plan A horse. They don't yet recognize that we are on a different playing field here. So they're responding to early attempts at plan B as if it's plan A. It could take a little while. Those are some of the possibilities. No, I actually have found that adults are frequently wrong about what's getting in the kid's way, and that adult solutions actually frequently, therefore, don't solve the problem. So I think there's great risk in trying to solve problems that way. I think there is nothing to lose by asking kids what's making it hard for them to meet a particular expectation. My experience tells me they often know better than we do. I'm relying on that. And no harm in engaging the kid in the process of thinking about what some solutions might be. So I generally find that solutions arrived at collaboratively tend to be a whole lot more durable and a whole lot more effective than solutions us adults come up with through our just sheer ingenuity on the basis of no information whatsoever from the kid. I just wouldn't do it that way. It would be like me going to the doctor, a medical doctor, and saying, I have this physical ailment. And immediately they tell me, here's what's the matter with you. And here's what we're going to do about it. Right? No questions, nothing about my other symptoms, nothing about anything. Right? I just told them I got a little pain right here, and they tell me immediately what it is. Right? No one would do that. I would walk out of that doctor's office. Yeah, I mean, I say that too. I say it in a slightly more refined way. Concerning behavior is communicating that there's an expectation a kid is having difficulty meeting. And we do need to find out what's making it hard for a kid to meet the expectation that's causing that behavior. But not by asking the kid why they're exhibiting the behavior. We know why they're exhibiting the behavior. They're frustrated about an expectation they're having difficulty meeting. So we don't need that. We don't need to ask them a very common question that caregivers ask kids, why'd you do that? And the answer is always, I don't know, right? That's not what you're asking in this model. What's making it hard for you to complete the double-digit division problems on the worksheet in math for homework? Now you're going to get info. And remember, it's that expectation that the kid's having difficulty meeting that might be causing them to throw a book across the room, tip over the table, start screaming and crying, all frustration responses. We're not asking them about their frustration responses. That is how they are communicating. But what they're communicating about is what we're asking them about. Difficulty completing the double-digit division problems on the worksheet in math. Not that useful. The antecedent part is fine. The synonym for antecedent is unmet expectation. The synonym for unmet expectation is unsolved problem. So in my opinion, different ways of saying the exact same thing. So antecedent isn't the issue, but consequences is an issue because many caregivers are taught to believe that it is those very consequences that are maintaining the behavior. The concerning behavior is somehow being rewarded. And we have to remove all those rewards to extinguish that behavior. And we need to teach and reteach replacement behaviors. When you're doing that, you haven't come close to identifying the unsolved problem. Well, you might have come close on the antecedent, which is the unsolved problem. What you have not come close to because you're assuming that it's the consequences that are where the action's at, is what's making it hard for the kid to meet that expectation. So when we move straight from antecedents to consequences, the problem is that rewards and punishments aren't problem-solving strategies. And so the problems never get solved. That's the problem with that paradigm. Number one, that's a tall order, because models like PBIS and multi-tiered systems of support and a lot of the punitive disciplinary actions are deeply ingrained. So this is no small task. At a very practical level, I'm talking to people either in the building or in the school system who I believe recognize that what they're doing now isn't working. And I collaborate with them on thinking about how we're going to move the ball forward. So number one, don't do this by yourself. But number two, you have the data working in your favor, because the data are not good. It's the same kids who are getting dozens of suspensions every year, untold dozens of detentions every year. Everybody knows who those kids are. We are not helping those kids. And that's proof that our existing structures are not getting the job done. Now, it is very seductive to believe, yeah, but for the majority of kids, the existing structures are getting the job done. Actually, you can get away with a lot with those other kids. It may not be working, but they're really never accessing the school discipline program. So it's a little bit of a stretch to say that it's working. What are we doing for the kids for whom the existing school discipline program is not working? Those are the kids who are accessing the program the most. Those are the kids we are in the midst of losing. How well are we doing by those kids, given that I don't even think the school discipline program is being accessed by the rest of them? We can. It's not something I focus on extensively because I don't find that what you just said makes sense in the abstract. I just don't find it happening very often. But I will say this, I've always said that a plan A boss is a problem to be solved. Where do you learn how to solve that problem? Plan B. And here's what's interesting. At the point at which you start having a choice, people might choose not to work for that person because that person doesn't listen to them, doesn't give them voice, doesn't collaborate. Yes, there are people like that in the world. And some of us have made decisions along the way that said, you know what, because this is going to be helpful to me in some way, I'm willing to tolerate this. But I don't run into the question that you asked very often. Bottom line is this. Plan A is not helping this kid. And I'm not going to do plan A now to get the kid ready for the plan A person in the real world. I'm actually going to have more faith in plan B getting this kid ready for the plan A people in the real world. Well, number one, an IEP is only going to be as effective as the people who are implementing it. That's the wild card. You can have the best IEP in the world that you think is perfect for your kid. And if the people who are implementing it are not doing very well by your kid, then that IEP really isn't helping you that much. So I tend to focus less on the IEP. I obviously like to have my T's crossed and my I's dotted on the IEP. But I'm much more oriented toward making sure that the people who are working with the kid have these lenses on, understand what we've got here, and are collaborating with the kid on solving problems proactively. And there are sample IEPs on the Lives in the Balance website that can be used as samples so that people can write a CPS-flavored IEP. You know, the bureaucracy is sometimes difficult to navigate, but what you described of the bureaucracy, manifestation hearings, these are signs that things are not going well. Yes, I have found myself in a dozen manifestation hearings in the last 35 years. But generally speaking, if I'm doing a good job of helping people who are working with the kid get the right lenses on, making sure we have an IEP in place that is right for this kid, but also flexible enough to make sure that we're meeting this kid where they're at, it's highly unlikely that I'm going to find myself in a manifestation hearing. I think compliance and our obsession with it is at the root of a lot of big issues that are not going well. I don't think that the goals of an IEP should be translated as behavior most of the time. I think unsolved problems should be the goals of the IEP. That's what we're working on. Depends a little bit on how collaborative those other adults are, especially the ones who are charged with writing it. An IEP, I don't really like to be IEP focused. The IEP is the contract between the school and the caregivers for what the school is going to do. That's how I view an IEP. It's contract, right? It is supposed to, by definition, be a collaborative process. By definition. Some schools don't do it that way, but by definition, it is supposed to be a collaborative process. And parents shouldn't sign off on an IEP unless they're happy with the contract. I don't sign contracts that I'm not happy with. Parents shouldn't sign IEPs that they're not happy with. It's up to the school folks to make sure that the plan that the IEP represents is good with the parents too. Otherwise, the parents aren't going to sign it. All of those things work in favor of collaboration. But this is supposed to be a team effort. Let's make sure that the schools view it that way. I wouldn't think about the skill. I wouldn't try to, number one, I wouldn't try to make a connection between here's the expectation the kid is having difficulty meeting, and therefore here's the skill the kid is struggling with. The skills are more for helping caregivers understand why the kid, in general terms, is having difficulty adaptively handling problems and frustrations, right? So if the kid is picking their skin, what I would do is try to word it differently. What do you want the kid to be doing? That's your expectation. That's the expectation the kid is having difficulty meeting. So that's what I would say to the parent. And yes, caregivers are often much better at talking about what the kid's doing that they don't like than in defining what they want the kid to be doing. But that's what the challenge would be. How are we going to word that so that it's an expectation the kid is having difficulty meeting rather than what the kid is doing that we don't like? And the reason for that is if we try to talk with the kid about the thing that they're doing that we don't like, they're not going to talk to us. They're going to think they're in trouble. They're going to get defensive. They're not going to talk. So how would we reword that so that it's an expectation the kid is having difficulty meeting? Anytime you put not in front of something, you're probably going to hear about a concerning behavior. That's what you don't want the kid to be doing. What do you want the kid to be doing? At the very least, I would put difficulty leaving your skin alone, right? At the very least. The other question I would be asking is the difficulty leaving the skin alone happening under certain circumstances? Because there might be an unsolved problem that comes even before the difficulty leaving the skin alone. So I would want to explore that as well. If I solve the early one, I will also solve the later one, the difficulty leaving the skin alone. So I would ask some questions about that as well. So as you can tell, goal number one is to word the unsolved problem in a way that is conducive to actually having the kid talk to us, right? That's goal number one. Beyond that, it all depends on what the kid tells us. And here's what it's going to sound like. I've noticed you've been having difficulty leaving your skin alone when you're watching TV. What's up? Whatever the kid says next, is the concerns that need to be addressed so that this problem can be solved. I was working with a educator. We were writing unsolved problems for a middle school student. And the first one he came up with was difficulty staying in the classroom during ELA. I said, we can write that one down on the ASIP, but I got a feeling it's late. What's happening before that? She's having difficulty staying awake in ELA, and I'm having trouble waking her up. Okay, difficulty staying awake during ELA. We could write that one down too, but I got a feeling that's late too. What's going on before the kid is falling asleep in ELA? She's having difficulty reading along what I'm reading All American Boy to the class. That's early. If we solve that one, the other two should be solved as well. So we want to push it upstream and go as early as we can, but you got the wording right. We just need to make sure it's as early as possible. And there's a lot of resources on the Lives in the Balance website to help them work their way through it.